Have you ever thought about a therapy that uses music, and only music, to tap into the unconscious mind? Well, today, we're diving deep into a method that's been doing exactly that for over 40 years. It's called the Catharsis Application Program, or CAP for short, and we're going to explore its incredible story told completely through the words of the psychiatrists who saw its power firsthand. So that brings up a really fascinating question, right? In a field like psychiatry, which is always evolving, how does one single musical program manage to earn consistent, unwavering trust from clinicians for 4 decades? What's the secret here? Well, let's find out. All right, let's start our journey way back in the early 1980s. This is where it all began, where a powerful discovery in a clinical setting would lay the groundwork for everything that was to come. So it all started in 1981 with an observation by a Dr. Murray. He was watching his patients listen to these musical compositions by Alana Muyal and then draw whatever came to mind. And he started noticing something uncanny. The symbols in their drawings seemed to match the titles of the music. But here's the kicker. The patients had absolutely no idea what the titles were. It was as if the music was bypassing their conscious thoughts and speaking directly to their subconscious. Dr. Moret knew he was witnessing something special. He gave it a name, the dynamic evolving impulse. See, this wasn't just about listening to some relaxing background music. It was an active, observable process that was creating a therapeutic effect. And that name, that idea, would become the very core of the CAP method. And this is the absolute golden rule. It's the secret sauce, really. For that dynamic evolving impulse to work, the patient can never know the title of the music. This is so crucial because it guarantees that their response is 100% their own, a pure, unfiltered expression from their inner world with zero outside suggestion. Okay, so let's jump forward a few years to 1985. This is when a really pivotal figure enters the story. Dr. Jacqueline Verdeau-Paolis. She was a highly respected neuropsychiatrist, and her involvement was about to give this emerging program some serious clinical credibility. So after several years of working with the method, by 1988, Dr. Verdeau-Paolis came to this incredibly powerful conclusion. She said, this isn't just a test, like a Rorschach ink blot, where you're just seeing what's already there. No, this was something much more. It was, in her words, a real therapeutic tool. It was an active agent that could actually help create change. So the foundation was set. It had a name, a core principle, and a major endorsement. Now, let's fast forward to the 2000s and see how this therapeutic tool held up after years and years of being used in a demanding, real-world clinical setting. The next piece of our puzzle comes from Dr. Lucien Ducloud. He was a specialist at a post-cure center, and his perspective is so important because it gives us a look at the program's effectiveness over the long haul, with patients who were facing some very serious challenges. And here's where the story gets really compelling. The timeline. In a letter he wrote in 2002, Dr. Ducloud mentioned that his center had been using the CAP method for over 15 years. Think about that. This wasn't some new experiment they were trying out. This was a trusted, core component of their therapy program. So what did 15+ years of use actually show? Well, Dr. Ducloud found that the music consistently helped create a safe space for patients to process trauma. It also helped them make the kinds of mental connections that are vital for therapy to work. And he noted it was especially effective for patients with what's called a neurotic structure. The bottom line, year after year, it delivered results. Okay, so as word continued to spread, more and more clinicians started to see the potential here. And what really struck them wasn't just how well it worked, but how versatile and surprisingly simple it was to use. Next up, we meet Dr. Christian Simonin. What's so interesting about his story is that he came to the method in the late 2000s. That's almost 30 years after Dr. Morit's first observations. It just goes to show you the program's enduring relevance. Dr. Simonin was just blown away by 2 things: how easy it was to use and how many different situations it could be applied to. He used it all over the place, from his private practice to professional rehab centers. And he kept hearing the same feedback from his patients. They were genuinely surprised by how much better they felt. It was a perfect sign of the method's subtle but deeply profound impact. And this quote right here, it really gets to the heart of what he believed. Dr. Simonin didn't just see this as a tool for his own office. He saw it as a public good, a method that was simple, effective, and inexpensive, and one that he felt deserved to be shared with as many people as possible. Now, let's just quickly circle back to Dr. Verdopiles because her commitment over the decades is just incredible. She went from helping shape the protocols in the mid-'80s to championing the method at major conferences, and her belief never faded. I mean, by 2009, she was even advocating for its use with Alzheimer's patients, which just shows how much potential she still saw in it. Okay, so we've looked at these different pieces of the story, these different expert accounts over 4 decades. What's the big picture here? What does this whole journey of psychiatric endorsement really tell us? It's actually a pretty clear and logical progression when you lay it all out. It starts with Dr. Moret, who first saw the phenomenon and gave it a name. Then, Dr. Verdo-Pales came in and gave it true clinical legitimacy, calling it a real tool. After that, Dr. Duclaude proved its staying power over the long haul. And finally, Dr. Simonon recognized its universal potential. You see, each expert built on the work of the one before, creating this unbroken chain of validation that stretches across 40 years. And so, we're left with this thought. The story of the Catharsis Application Program is this powerful reminder that some of the deepest healing can happen in the space before words. So after seeing all of this potential, all of this history, it leads us to the most practical question of all. How can this proven method become a part of your practice and literally transform the way you help your clients? Bringing CAP into your practice is about so much more than adding a new technique. It's really about opening up new possibilities. You can attract a whole new group of clients looking for creative therapies. You can offer a treatment that's not only effective, but also really motivating for the patient. And because it's so well structured, it's easy to collaborate with other professionals. And you can even offer it both in person and online. The training to become a practitioner is just as thoughtful and comprehensive as the method itself. It's a 19-month program that gives you a great mix of online workshops and theory, plus essential in-person internships. And it's all capped off with 9 months of supervised practice. So by the end, you're not just familiar with it, you are truly confident and competent. And here's the absolute best part, the thing that really guarantees the quality of the training. You learn it directly from the source. The entire training is led by Chantal Desmoulins herself, the co-creator of the program. You are literally learning from the master. Look, this method has a 45-year track record of helping people say what they can't say and find real, lasting healing. The proof is undeniable. So the only question left is for you. Are you ready to unlock this new dimension of healing in your own practice? If the answer to that question is yes, here is all the information you need to learn more and to start your journey with CAP. Go ahead and reach out to Chantal Desmoulins to take that next step.